Hi everyone, this is Jasmine.
Hi Jasmine, welcome. This is Karthik
Thank you.
here from Charcha Impact. Hi
Thank you.
Mr. Singhal. Pleasure to have you with us.
Hello, Mr.
Hello.
Jasmine and Mr. Karthik. This is
Hello,
Deepak
Mr.
Singh.
Singhal. Nice to meet you.
Yeah, good pleasure. Yeah.
Pramod is just running a couple of minutes over from his previous session.
No problem, no problem. So let's have chit chat with Jasmine in the meantime.
Yeah.
What's your experience,
Pleasure.
Jasmine, in Delhi? I worked 38 years. Cabinet secretary is my batchmate. We're all batchmates together. So.
No, I can imagine. You are. We have a lot to learn from you and hear from you today.
No.
I have been in the development sector for 15 years, but
Yes.
with the Delhi government for the last 4 years. I've been working in think tanks and non-profits as well as the private sector before this.
So, which private sector, Jasmine?
So this was my first job, was ITC in the FMCG, and then worked in urban policy, by and large, monitoring, evaluation, research, many of those roles. In Delhi, there is this commission that we have, Dialogue and Development Commission. It is, in a way, a mini Niti Aayog at the state level. It's
I'm aware. I keep on speaking to your chief minister every 10 days on mobile. So
okay, all right, you're aware about DDC.
So no, we are all in touch with each other. So
wonderful.
Wherever the issue, I have created a SOP because everything has to be done on autopilot. Today it's a dark tunnel. So I have sent an SOP to Arvindji also to get it implemented in Delhi. I'm happy that he has picked up a lot of points in that, and because he's very open most of the time to suggestions. Yeah. And ultimately, the decision maker, politicians, has to take their own decisions. But it's an open kind of person who can get the viewpoints of various people and try to get it implemented. Because today the challenge is implementation on the ground. Today we've been telling that no one should go in trucks. 24 people have been killed in accident.
Yeah, absolutely.
So telling on screen and ground situation is different. So you yourself see in Delhi, first day you had 2 lakh people in ISBT terminal.
Yeah.
So things are, things have to be seen what is there on the ground.
Hi everyone. This is Pramod. I'm so sorry I was late. The other panel ran over by a few minutes. Who else do we have here?
Hi, Pramod.
Karthik, you want to go on? Karthik, may I suggest if you could also go off video?
Yeah.
Thank you. But Deepakji, thank you so much for being here. And Jasmine, thank you for joining in. Really appreciate it. We have the Charcha team and we have the Asha Impact team with Karthik and Aparna and everybody else here, and Sanchi. Again, I apologize for being slightly late, but we have who do we have from the Charcha team over here right now? Do we have anyone?
Yes, Pramod, this is Sriram here.
Okay.
I've been basically anchoring the philanthropy and fundraising track and closely working with Karthik and team on this.
All right, wonderful. Well, our discussion today is about the role of government in the new normal. And I thought what we could do is talk about it in 2 or 3 ways. One is, how do we think about what the government can or can't do in today's environment? How should it open up given the level of uncertainties, given this is not going away? Now, most of our audience and the people will have already read up on this. In many cases, we don't need to go over, what is already known. But I think the issues in India are unique and very problematic. The issues of migrant workers, employees, etc., are also very, very problematic. So I want to touch on that and how the world will open up, how the economy will open up, what will happen to the individuals, what will happen to all of us as citizens of this wonderful country. But then also move to the post-COVID world. What are the changes we should make? How do we all need to work better together? The lack of trust between government and citizens and industry is profound. How do we overcome some of those issues? In particular, Jasmine, I'll come to you, particularly in Delhi, how has the government, been able to rope in all the volunteer efforts, everything else that has happened to try and solve many of these issues, which really have formed the backbone of the government's effort in many ways today. Deepakji, you've been the Chief Secretary of UP, and you, as you said to me a short while ago, you've been there for 38 years in UP. Very few people have spent that much time in one state doing everything from district collector to home secretary to chief secretary, etc. In particular, the issues in UP are profound. So let me open this up. First, if I may, Jasmine, I'll come to you. Tell me what you think, how this opening up is going to happen, because this problem is not going to go away anytime soon. And there is a sense of fear in India that our healthcare infrastructure will not be able to cope, and our population is just way too much to deal with this issue. Our numbers are already crossing China. Social distancing is a myth for most people. To ask them to keep social distances to some extent, not practically possible. It isn't going to happen. We don't have testing capabilities to the level we have. In that context, how does one go forward? And then I'll come to you, Deepakji, if you won't mind, to get your thoughts on that. But Jasmine, may I turn to you, and may I ask you just to introduce yourself very quickly also for 30 seconds.
Sure. Okay. Thank you, Pramod, and thanks to Charcha. It's my pleasure to participate in this discussion today. Very briefly, I'm a graduate of IIT Madras and Columbia University. I have worked in the private sector, in some think tanks, in the non-profit sector, and for the last 4 years, I have been associated with the Delhi government. I had this body of Delhi government called the Dialogue and Development Commission, which advises the government. It is led by the Chief Minister, and I'm the Vice Chairperson. It advises different ministries and departments on both policy design as well as implementation, and especially it acts as a bridge to the external stakeholders, trying to forge more and more collaborations and partnerships as we try addressing some of the complex governance challenges that Delhi faces. Now, Pramod, the question that you asked in terms of how do we in India should think about post-COVID world, right? First and foremost, I think our language has to be living with COVID world, because right now we don't see when is a post-COVID world going to dawn upon us. So what does living with COVID world look like? Because yes, we figured out, lockdown, ordering a lockdown has been difficult on millions of people, but the mechanics of it, we figured out what has to be shut down, and it's easier relatively, I would say. But when you think about opening up after this lockdown phase, I do not think any kind of a unified central strategy makes any sense. There are many different Indias within India. Within a state itself, there are large cities which function that A, the risk of COVID spread is higher, and B, their healthcare management capabilities are different than other parts of the same state, perhaps. Therefore, I think there is a big need to really empower the state governments and really decentralize some of this decision making and preparation tasks. Now, especially in Delhi, there are one or two very clear ways in which we, led by our Chief Minister, Mr. Arvind Kejriwal, have been thinking about these issues. Given the current scientific evidence, we know that COVID is not going to die down anytime soon, which means that the entire purpose of the lockdown was to actually ensure that we really ramp up our healthcare infrastructure or our preparations. I mean, you can't build too many new infrastructure, you have to repurpose existing infrastructure. But in terms of supplies of PPEs, ventilators, protocols, exactly the testing capabilities, these are the things that most cities and the high risk areas of the country ought to have figured out by now, because we're already around 45 to 50 days into the lockdown phase. And especially when it comes to Delhi, it's something that we say with a lot of care, that we feel really prepared that, right now we are at around 5,000 active cases. Even if it goes up to 30,000, we have a plan which is already set in place. But of course, if we have to go even beyond that, we are very confident that this is something, I don't think we will reach that point, But this is something that in Delhi, with the infrastructure that Delhi has and with the staff and the personnel that Delhi has, we can manage it. And therefore, the costs of the lockdown have to be weighed with the benefits of the lockdown. And we are seeing that, with every passing day, it is putting a humongous toll in our economy, on the livelihoods of our people, and there is a humanitarian crisis that is brewing. So that is why we are one of the states which are leading this call of saying that, yes, now let's put our energies and focus in opening up our economy. We have collectively as a nation locked down. There have been benefits. Everybody agrees with that. But the entire energy and focus now needs to go into restore back our economy, because beyond a point, even states are not going to be able to, without any revenues, you're not going to be able to pay for your hospital staff or, any additional healthcare strategy efforts. So that's broadly how we've been thinking about. At the just one more point I would like to add, Pramod, is amidst all of this, the humanitarian side of what governments ought to do has been very, very clear. This is something that, along with ensuring that we care for our doctors, nurses, provide testing and bed facilities, taking care of those who do not have a shelter or food to eat is also one of the primary duties. And as far as Delhi is concerned, the entire city, we are very proud how the entire city has come up, be it NGOs, be it volunteers of Aam Aadmi Party, be it civil defense volunteers, be it RWAs, multiple stakeholders have really come together to set up close to 2,500 food distribution points. And, we're feeding close to 10 lakh people lunch and dinner every single day. Ration has been given out to 1 crore out of the 2 crore people of Delhi. So there has been effort, and all these systems were built over the last 45 days, because we never had 2,500 cooked food distribution points. So clearly there was a massive effort that was put in. A lot of it was because civil society worked together with us. The government was there as an entity to lead and to coordinate, which is important, rather than relegating the entire work to the civil society. And I feel there is that semblance that, yes, Delhi has been able to take care of the humanitarian needs at this point in time, but our effort now is to open.
Pramod, you need to unmute yourself, please. You're on mute.
Yep. Can you hear me now?
Yeah, I can hear you.
Okay, sorry. So, Jasmine, I'll come back to you on many of these points, because I think there are significant issues that are ahead of us, not just in Delhi, and I want to go beyond Delhi, because this is a global audience and being done from everywhere. So I want to go into India and what we should do as a country versus what perhaps other countries have done. But I want to come to Deepakji. Deepakji, you've been a representative of the most populous state in India, 250 million, 25 crore logon ke liye. The infrastructure that is available there, the reality of that India is perhaps something none of us are really familiar with. So will you tell us about it, what the challenges are, and how we should try and tackle them at this time?
Pramodji, first of all, I'd like to say thanks to Charcha and to your august audience that you are giving us an opportunity to share some experiences and our thoughts on the subject, which is a national, international crisis, and this our generation has never thought of. Sometimes we are thinking that we have the nature has really done an attack on the humanity, that you have attacked us 60, 70 years in our generation. Now this is for the time for us to attack humanity, and you see the environment has become cleaner in lockdowns, and lot of people are not going to the hospitals. The people are doctors telling the disease is lesser. Now coming back to your fundamental question, the biggest challenge today is the three dimensions of corona, which I like to share one by one. And one is the political dimension. Second is the migratory population, which is a key issue today. And third is the dimension, which I think is the economic dimension. And fourth is the medical dimension, which is the thing which I want to say. So one by one, if we take the political dimension, Pramodji, I like to say this is the time that country is in a war mode. So my request at that stage is, and that a message to especially to the media, to everyone, that this is a time that there should be a national kind of thinking in the government. oppositions, on everyone, they have to work together for betterment of people. Humanity is the first criteria which is to come in. They can give constructive suggestions. But as Mr. Jasmine was telling, I completely agree that the solution is decentralization, because India is a very big country. What you do in Delhi is not equally, if you see, go to Balia, Basti, Gonda, Bahraich, these areas now, they will head for floods next month. And there are additional crises which will be coming in, which will not come in Delhi. So what kind of floods will come in this time, you don't know. The dark tunnel of Corona is also there. The economy is the people are in abject poverty in Eastern UP. We are all well aware about these things. So if you see a composite package, so the political, my only request is that whatever we design, it should be highly, highly decentralized. And I like to quote from my administrative experience, section 46, 47, 48 of the Disaster Management Act, which supports Jasmine's point of view that everything should be in terms of management, and the finance should be decentralized to the local district collector. It is defined in the act. And the government should come out immediately for mitigation and response funds, which is defined in the act. There should be specific funds which should be coming out. Some efforts have been done. A lot of people are doing effort, but now the government machinery is also tired. You should see that last 2.5 months in Maharashtra today, we heard 1,200 policemen has got corona. A lot of government machinery is also now totally tired of the situation. And so everything we have to see in the management of corona is like an ATC. Suppose जबरदस्त तूफान आता रहे और सारे जहाज दिल्ली में ना उतर पाए, तो 90% जहाज has to be diverted somewhere. So ATC doesn't take command from the Chief Minister of Delhi or Prime Minister of India. Some person sitting at ATC drives the aircrafts. So my only suggestion as an administrator is everything has to go in an autopilot route, because it's a dark tunnel. It's a very difficult tunnel. Second part is the migration part, which is a serious challenge today. No, I don't want to get into all that. Some countries where they did give a lot of time. And I think we have to all accept. Honorable Prime Minister also accepted that वो इस बात पे दुखी हैं कि लोगों को इतना कष्ट झेलना पड़ रहा है. It means we should not do a kind of analysis that we did something wrong, but what we can do today, because after all, if these people could have gone 45 days back nearest to their homes at that time by railways, and this crisis should have never come कि आज जाके 24 लोग मर गए औरैया में और महाराष्ट्र में मर गए और रेलवे में 16 लोग मर गए. It becomes very, very pathetic situation, because there you realize that 68% population of India, rural India, क्या उनको सम्मान से जीने का हक नहीं है क्या? तो ग्राउंड रियलिटी क्या उनको खाली हम लोग को जो दिल्ली में बैठे हैं नोएडा में उन्हीं को सम्मान से जीने का हक है? ये एक बड़ी पैथेटिक सिचुएशन, राइट फ्रॉम फर्स्ट डे फ्रॉम बस स्टैंड टू टुडेज डे, lakhs and crores of people are giving. Secondly, जो इसका मैनेजमेंट जो है वो उसके challenges क्या हैं, what is the solution? That is the thing which I like to sum up in 2-3 words. Challenge, what are the challenges? I start from my home. I don't have money in Surat. मेरे पास, I want to go to my parents, so I have to go. Means you tell me to stop back, I will not stop back. Now if I start, then only solution is either you may transform so Surat, नहीं तो मैं पैदल चल दूंगा रास्ते में जहां जाता जा रहा हूँ. Second way is government says we will give you food packets on the highway. Tell me, I've been a collector for almost commissioner 12 years. Which administrative machinery is available on highway on the behalf of the revenue department to give you food packets? वो रास्ते में लंगर ही लगेंगे और कुछ नहीं हो सकता है. It is not possible in a highway of 300 kilometers कि every kilometer there is a तहसीलदार और नायब तहसीलदार. यूपी में वैसे ही इतने गांव में तो तहसील लेखपाल होता नहीं है, तो वहाँ हाईवे में कौन सा लेखपाल बैठ के आपको खाना वाना वहाँ पे देगा? So this the logistic issue of helping them, you can say on a television, governance through television and Twitters के भाई we'll give food to everyone, we'll do this, we'll give medicine to everyone. हम ट्रक पे किसी को चढ़ने नहीं देंगे, लेकिन ज्यादातर जो लोग निकल के जा रहे हैं उसमें 60-70% ट्रकों पे चल के जा रहे हैं. And you have rightly said, Pramod, there is no concept of social distancing. वो हो ही नहीं सकती. Physical distancing is feasible है ही नहीं. ट्रक में अगर 60 लोग चढ़े हुए हैं, suppose, how can you have a physical distancing in that truck? Once you reach the village, how it is possible? It is not possible. So once we have to understand that those things which are not possible, once you reach village, then you have to do a concept of quarantine. Now you see, we have seen the conditions of PSC and CSC, especially Uttar Pradesh, I can tell with full authority, it is highly, highly dysfunctional sub-centers from ages, for last 20-30 years. The doctors don't stay there. That is a problem. So basically, once you have dysfunctional kind of PSCs and CSCs on the ground, how do you handle this with this challenge? So basically, again, we come back to this thing कि भाई हम अपना Vedic sciences पे जाएं, we will have more immunity, villagers have more immunity, they will have गन्ने का रस पी के भी ठीक रहेंगे, you know, something of that kind. So basically, you have to do immunity sciences. So this challenges of migratory laborers are phenomenal. Now, I'll tell you not the problem, but the solution, because you know we can all handle, we can all say कि ये problem है, वो problem है. The problem in the governance today is that we all analyze problems. We don't come out with solutions, and the good governance means solutions. Now, basically, whosoever is interested to go back home, they should quickly be, because it should have been done the first day. But if it have not been done first day, might be there must be reason behind not doing it. I have no authority to say who took a decision, how they took a decision. But suppose they have not gone, now at least whosoever wants to go, with full fight, full endeavor, full support, 100% cost to the government, 100% cost of food on the platforms, food on the highways, creation, these kind of things, what has been done. For example, Delhi, Dasmin, he was telling, but you know, suppose 300 kilometers from here to Lucknow, from 300, 400 kilometers from there to Balia, these kind of highways, they should have all food packets. Then when you reach to home, quarantine at your local school, then you have to take them from this, and then you have to give them work. Fourth thing is a part of the work. So my only request is, when you reach back home, that you can take 2 programs. I can suggest Narega 2 programs. That one is the Ghoul program, which is means like in your entire areas where all your public roads are being broken, where there are murders every day in the rural India, and rural especially in UP. At this time, you take an opportunity to use this labor workforce for 60 days and give them Narega work and get all ghouls open. Secondly, is the taking water to the field. All thing is broken. UP, I know practically 2 lakh kilometers is broken. You know, from the canals, nothing goes to the ground. Now, you should take this opportunity, give them 60 days work, and then think of coolly whether 50% of people will come back from there or 50% of people will not come back there. Now, you have to really analyze at this level, because you know UP is a very big state, or for that matter, India is a very big country. Some people might not like to go back. You have to analyze, because you don't know the data, who will go back and who will not go back. So you have to do contingency planning for who will go back. Now, if you will go back, then you again come back into the urban areas. Then you again come back to the urban areas. The government's today's notification says that 5% random sampling will be done. Who will come back to Noida in a factory? Now, who will do that 5% sampling? Testing capacity is very low. And in related issue, the last economic issue is that, you know, you have to come out with a scheme of chalo gaon ki or, chalo block ki or. India has got 6,600 blocks. 6,600 blocks. In 6,600 blocks, if we have started, with my own experience, I have taken a block in Mathura district where I have been able to take last 15 days as my passion towards rural development. I thought, let me work out in this crisis a plan where it can be acceptable to the entire rural India. And this was done by Abdul Kalam Sahab in 2004, called Pura, but it failed that time. How can we make it successful? You'll be happy, you know, the last 20 days itself, we have got a data built up for almost 28,000 families on ground. कि किसके घर में कितनी बकरी है, कितनी गाय है, क्या चीज है, what kind of profession he can do, what kind of vegetables he can grow, what kind of milk he can grow. These data are under preparation, and next 3-4 days we'll be ready with the data, and we'll try to come out with some plan. And there, you know, sometime once we are ready with this data, there the role of experts like you will start, because you know the best of the world in terms of technology. You know the best of the thing you've done in education and in various parts of the world, work in various parts of the world. So there will be a connecting scheme between people like you, people who have in industry, trade, and because they understand how to do a business. Government doesn't know how to do a business. Basically, that is the kind of model I'd like to suggest.
Yes. Divakji, I think, you know, I want to come back to some of the points you're making, because I think we must recognize that the challenges of rural India, particularly in states like UP and Bihar, jaise hum baat kar rahe the earlier, you know, do we have ventilators at hospitals? Do the doctors know how to use them? Does the nursing staff know how to use them? I mean, these are the realities on the ground. We can perhaps, Jasmine, in Delhi, we can prepare for these, but how do you prepare for them in other parts of the country? And I do want to touch on that, because that's where the major portion of the population live. Apart from that, though, as we go forward, I think the phrase that you have used, Jasmine, is absolutely right. This is living with COVID. This is not a post-COVID world. This is going to be a world where you learn to live with it. So how do you think businesses and the economy must be reopened? Obviously, it's being reopened right now. Is there a danger of a subsequent shutdown as we reopen? Particularly, Deepak, I'll come to you also on that. As in UP, you open up places. Do we even have the ability to understand and track where these infections are going, where this disease is going? Once we cover those topics, I'm going to move, if you won't mind, into the future. I really want to think about hope. I want to think about optimism all the time. I think we are, as a human race, built on that. We survive based on that. So I want to ask your thoughts about, as we learn to live with this, how do we build out the trust, and how do we build this collective effort that we have seen already of NGOs and individuals and people coming together with government to make a big impact here? I'll come to that later, but let me come back first to the opening up the economy to both of you and ask you for your ideas there.
So, very good question, Pramod. I think this is what we've been thinking very deeply for the last couple of weeks in Delhi. And even if I have to sort of think from the national perspective, I think some sense of perspective in terms of, what is, I mean, at the end of the day, this is, I mean, living with COVID is going to look like living with tuberculosis or living with malaria. And some sense of proportion is extremely important. Yes, this is an infectious disease, but 4 lakh people die out of tuberculosis every year in India. So have we started completely banning certain sectors or certain sections of our economy? The toll due to HIV, the toll due to malaria is also quite substantial. What we do is we take commonsensical precautions, which individuals as well as government systems and healthcare systems take. And I think if our ability to open up successfully is going to be how people behaviorally adapt to these kind of, way of life, so social distancing, mask. Yes, we all agree that it is difficult. This is something that people, nowhere in the world are they used to. But in India with density, and maybe in some pockets it's not going to be possible, but there again the idea of bubble comes in. So if you're in a family which is staying in a closed space, then probably it's going to be difficult. But when you are out in the open, everybody, the entire population should follow certain norms. And businesses and workplaces have an extra duty and responsibility, and I would say even the civil society. So if you're an RWA, you should appreciate that opening up the economy is important, but monitor the violation of these essential norms of, wearing masks, social distancing, mandating washing facilities, making it behaviorally easy for people to adapt. So have sanitizers at all points, have mobile wash basins if you need to have it. So the sooner we retool our economy and make our people adapt to these is, I think, going to determine how successfully we open up. How do governments ensure that? I think this is where the leadership and communication comes in, because if the government is able to portray a sense of preparedness, a sense of readiness, that look, at the end of the day, we do have our hospitals, we have our healthcare facilities geared up. That is our duty to ensure that, even after all the precautions, if you fall ill, we will ensure that emergency medical care is available and people won't die. That death rate is the real one that troubles people, but if it becomes like a normal flu, I mean, like malaria, normally you don't panic. You go seek the right healthcare when you fall ill with malaria. Similarly, if our government are able to prepare the systems and then really communicate to people that, look, ensure that you follow these norms and make sure that communication is directly happening from the government to people, I think that will really get people comfortable with the idea of opening, because right now we still have an air of panic, which is not good.
Unmute now. Sorry, I keep muting myself and then finding out that I'm mute. Don't realize I'm muted. I think these are great points, great suggestions. We'll come back and talk about the future. But the one other thing I would add, though, is, there's a huge fear also in India that we just don't know the scale of the problem. That perhaps in a place like Delhi or NCR, we can absolutely prepare for it, but is it physically possible for us to prepare for it in many other parts of the country? Do we know, do we even believe the numbers? Frankly, I don't think you can believe the numbers even in America in terms of infection. I can tell you, I have a lot of friends there. Many of them have been infected. They're not counted as part of the numbers. They found out because they were close to somebody else who was tested positive. So they got tested and they were told, yes, you have been positive and it's passed. So the numbers could be, and certainly my discussion with doctors, to be honest, we are setting up a COVID-only hospital in Manesar, Haryana. Jasmine, I've worked with you on a variety of getting PPE equipment and food deliveries. And, right now this call center that is running by Genpact to aid patients, all of these things are happening. But I don't know that anybody believes the numbers, right? That do we really know the scale of the problem? And Deepakji, in UP, how can you get your arms around the scale of this problem? It is so humongous. How would you do that?
Pramodji, I will say that that from the national as well as state perspective, that as I'm repeating, our country is huge. The medical support system getting out of NCR depletes so fast that you can't imagine the ground reality. The more you go into the interior areas, it further goes down into a different direction, which probably person sitting in Delhi or US, he cannot imagine the ground reality. I have seen myself as PSC and CSCs where there was nothing except grass inside and people trees inside. I can tell you that at least there will be a couple of these kinds still existing where people must have not visited them for last 5 years. So that is the ground reality.
If you can just, Deepakji, expand on those acronyms you're using, perhaps some people in the audience won't know what they mean, the PSCs, etc.
I can tell you, like, for example, to the audience, benefit of audience, like a district level, district is divided into tehsils and tehsil is divided into blocks. Usually a district, like UP has got 75 districts. And as our colleague was telling, the India has got almost 732 districts and almost 6,612 blocks in the country and on 7,000 villages. That is a kind of administrative setup in India today. Now, coming back to this, every district has got district hospitals, then a primary health center at the block level and sub-centers at the village level. So that is a kind of mechanism, and it is not only the problem which is there for the human well-being, that is also a problem for the animals. We should not forget about the animal problems, animal diseases which are arising out of the lockdowns which is taking place because not getting treated. So this is a second aspect which we have to keep in mind. We are only been talking about human beings. Forget about the stray dogs, stray cows, this thing and that thing happening. This is itself a big challenge. You have to see, this we have to evolve a mechanism of discussing about animals also. Now,
yes.
So basically, you see in totality, the ground reality is that there is a very weak medical infrastructure. Secondly, the ground reality is that the government machinery is getting tired. I might be repetitive. Thirdly, the COVID, I slightly disagree when Jasmine Saab was telling me that it is almost a COVID, we should treat it as the same as TB or malaria. COVID, the problem is COVID is that you are a human bomb to other person. In malaria, you are not the human bomb to other person. So that is a basic difference. If had it been a situation where you are not a human bomb to other person, then there is no danger. Here, your Padosi is having a problem because of you, or a second neighbor is having a problem because of you. You're going to have all the third person having a problem because of you. So these kind of things which are important, which has to be highlighted. But yes, we have to learn to live with it. We have to learn to live with COVID, and we have to learn a situation that how can we work, life and livelihood has to go together. So that is the second thing which I like to say, we both have to go together. Now, coming back to this situation, what are the economic challenges? And you said whether this opening up what will affect, whether it will be positive, can it be reclosed? These things are only conjecture at this stage. We don't know what will happen. Every day will be a great learning experience. You see, in Noida kind of place itself, there is 8 lakh migratory laborers in Noida, which runs almost 11,000 industrial units in Noida. Now, out of this 11,000 industrial units, out of 8 lakh laborers, 4 lakh has already gone from here. Now, if you have to restart the small, medium industry, if you speak to their perspective, there is a great economic challenge. There is no demand into the market. One, there is no demand. That is a large chapter. Whether the industry can sustain by the only money supply through the loans, that is again a situation which is very difficult situation. So it's the entire economy is into the spin. When it's an economy is into spin, it's a very, very difficult thing. But I think India, भगवान ने हमारी हमेशा मदद की है, तो I think we should be all be hopeful. We should not be pessimistic about it. We have been able to so over centuries, we have been able to come out with a lot of difficult problems, and we will be able to come out with it. I think we should be very hopeful and optimistic about everything. But my only suggestion is that this day-to-day monitoring, sooner or later, the day-to-day monitoring from the government level has to go off, because it has to become a way of life. The moment you see only on television since morning till evening only corona, then your mind is in the sense of fear. Every time there is a sense of fear, and so I think the media has to reorient. I think they should be more speaking of larger issues of economy, reorient from only medical part of corona, go to the economic part gradually. So your mindset will change. Today you open in the morning, you see only that so many people
Absolutely.
died. So many people are like there. So many people, every WhatsApp you see this kind of situation. So there is a threat. But for the rural area, they have not threatened about it. वहाँ तो ये ना भूखे पेट ना भजन गोपाला, वो उनकी problem भूख है. And I am seeing as administrator, it's a great threat. I can tell you in times to come, if the book is not settled properly and there are no work spaces available for immediate and future, then there can be a situation, there will be a lot of crimes coming up in the rural area. You see, people will be doing a lot of lutmar into the rural area. Then they will say कि भाई ये अब क्या करें, पैसे है ही नहीं, क्या करें, अब कैसे अपने family को मरने में. So you have these kind of challenges are ahead. But I'm sure, I can tell you one thing, that this will take its own, the immediate, जो हमारा immediate future in next 3 weeks का, which is to be watched, because your numbers have gone up to 85,000. Some people it go to 3 lakhs, 4 lakhs, 5 lakhs. The testing will go up. Second part is the medical thing, which I'm saying, but I'm not an expert on this, but I was speaking to various doctors, and this panel, I'm sure there must be, in the audience, there must be a lot of doctors also. They can debate of it, whether the rapid testing kind of thing, which was failed in India initially because of poor kits, where other countries have used it successfully. Can we do it very fast in this country? Because, RT-PCR is not available into the rural areas. I do a test in Balia, my report will come back after 7 days. मैं 7 दिन वैसे ही डर के मारे मर जाऊंगा रिपोर्ट देने के बाद. बलिया से जब रिपोर्ट चलेगी, आते आते उसको जाएगी, कब आएगी कब जाएगी कुछ पता नहीं है. तो unless until there is a decentralized testing situations, this has to be seen only by the doctors. I am not an expert, but my doctor's friend says it is doable. वो एक बार अगर फेल हो गया कोई चीज, मान लीजिए रैपिड टेस्ट अगर चाइना का खराब निकला, इसका मतलब ये नहीं कि दुनिया में सारे रैपिड टेस्ट खराब है. कोरिया में तो सक्सेसफुल हो गया. You can get Korean kits. Andhra got the kits. But this is the third thing. Second, so at this point you raised it about the ventilator. Now today I was reading on Twitter, Prime Minister of America says that we'll donate ventilators to India. Now ventilator is a very peculiar machine. I have seen it on the ground. If you go in an operation theater, every operation theater, the oxygen giving machine is a ventilator. Is a crude kind of ventilator. But ventilator is a machine. It is not like a drip. You can't use a ventilator like a drip where you could just put in a hand of a person and using it. For running a ventilator, you have a doctor and expert. How many doctors and experts are available? Even if we give a ventilator in a village in Balia or Basti Gonda or somewhere, even if in a rural Meerut, I was district magistrate of Meerut, I can challenge none of the doctors in NCR, beyond NCR, can run a ventilator. They don't know how to run it. Now, if you don't know how to run it, then what is the need of a ventilator to be there? So basically, these kind of things are there. And last thing I like to sum up is that the sense of fear has to be taken out first. The mortality rate is low at this stage. God has been kind in India. So this has to spread very fast. There is no need to be panicked. हो सकता है, I might be having, I came from New Zealand on 2nd of February. I must have had for 10 days. So you never know who is having. हो सकता है आपके पास भी हो सकता है किसी आपको दोस्त से कल लग जाए. There is no need of panicking the entire situation. And I think we have to reorient, reset our mindset, and basically be ready to live with it properly for a long time. An economic model, I'm repeating, I might be sounding repetitive, please, but you know, you are having an audience who are globally well connected. They should come out with, lot of people should come out to support entrepreneurship at the block level. The moment you have 20 good entrepreneurs at block, India will transform in a span of 1 year. I can guarantee it to my experience. You will have milk chilling plants in blocks. You will have vegetable processing plants in blocks. Or, you know, today, if you see for last couple of years, I'll tell you one small example of mobile industry. Mobile industry was, yeah, you can please continue.
Let me, Deepakji, I'll go into those a little later. Let me go into some question and answers faster, if I may, because I think we've got only a little bit of time left. We only have 10, 15 minutes left. So let me try and, if I may, get into a faster thing. Looking at the future, there's an enormous level, Jasmine, what we have been able to achieve with the NGOs and the volunteer groups and everybody coming together, not just in Delhi, but every city that I've heard of, is phenomenal. How do we tap into that and build a framework for all of us to do that in the future? Because right now we're responding to a crisis. Is there a way in which we can build those platforms? What I have found remarkable about this has been that the government has facilitated this. They have leveraged this willingness to help and coordinated that effort really well to make it work. One of the issues I've always felt in India is we have, I think, 3 million NGOs. Every little NGO trying to do its own thing, as opposed to a way of bringing them all together so we can leverage their collective capabilities. Last one I'll make, Deepakji, in response to your point, and then I'll come back to you, Jason. You know, to some extent, I think this crisis is overblown by the social media. I don't want to underplay the importance of the crisis, the urgency, the issues around it. It's the biggest crisis of our lives. But you're absolutely right. Waking up every morning, counting every death, counting every infection. I mean, had we done that with heart disease, cancer, malaria, diabetes, everything else, we would be going completely mad at this point in time. And there is a need for us. There is also no other news coming out. There is nothing else to report. There is nothing else happening. When you're in a lockdown, there are no sports, no exhibitions, no retailers, no traffic, no nothing. There is nothing else to report. So media jumps all over it. And I think that's an issue which also is will benefit from the economy opening. Jasmine, let me come back to you. How do you think about opening up the economy? How do you think about building platforms that allow us to really leverage the collective efforts of the citizens of India? To me, that's a big movement, which has been quite amazing to watch.
Yeah. So, Pramod, not so long back, I was on the other side of civil society, a non-profit, a think tank, trying to offer, the government, say that, look, we have a certain expertise, we have a certain experience that probably we can add value with. And the problem at most of the time of the government is that they are inaccessible and they are unreceptive. And I think a crisis, hopefully a crisis like this, at least woken up some of the people inside government that, for most challenges, let's accept that government do not have all the answers. Government can take the lead, can set a suitable policy, but if you're not going to really agglomerate all the positive energies of the larger society, be it private sector, be it non-profits, be it well-meaning individuals, you are not going to do as good as you possibly could. In Delhi, from day one, and I think this is part of what, part of it is just sort of what kind of leadership there is. I mean, are you open to ideas, suggestions, taking inputs? And it is both at the executive leadership, the ministers of a government, but also the MLAs, because a lot of the NGOs and civil society operates at a local level. But the second is whether you have structures where the external world can easily plug into. And I think creation of these kinds of systematic platforms, not letting a crisis let you know that, by the way, there are these organizations who work on healthcare data systems, or these organizations who have a very innovative technology model of, running hospitals or whatever it is. But in Delhi, and I can tell you that from experience, is because this commission that I'm a part of, Dialogue and Development Commission, one of the major roles that we play is essentially act as a bridge between the government and the external world, and try and bring in those capacities that we know for sure that actively the government may not have. And it makes it easy then for people to reach out. I would like to believe that our ministers, our CM, everybody is accessible, but there are also platforms and organizations like DDC that actively are working towards bridging these partnerships. And we know this in the example of GenPack, because we had a need to really communicate daily with the patients and really find out what are the additional supports the government can provide. By the way, in Delhi, every COVID positive patient gets a call just to find out how are you doing and do you need anything else beyond what we are providing. And we are collaborating with GenPact on that. And as Dialogue and Development Commission, we bridged that partnership. We made sure that both sides understand each other and we have a working model. So I feel some of these structures needn't be left to intuition. A proper organizations, platforms, and formalize these partnerships, not just in war times, which are where we are right now, but even in peace times, because then we don't have to scurry around the way we are doing right now.
Yeah. Jasmine, how do we open up the economy? With what risks? What does that include? How risky is it? Because, there's articles already about our rates are doubling very quickly. Our numbers are going to go sky high. We should expect that. The fact is we can easily expect this go into lakhs, perhaps multiples of lakhs. With what risks we open up?
Yeah. So as I said earlier, I'll go back to my first point. I don't think there can be. I mean, yes, we know that we are an integrated market. Even in India, your supplier could be in UP or your consumer could be in Haryana. But the healthcare system of the state should let the political leadership decide how comfortable you are about opening up. If like Deepak ji is saying that nobody in Meerut might know how to run a ventilator, that is a serious problem. You have to really be worried about opening up in a large way in parts of UP where the healthcare system may not be able to respond immediately. But in Delhi, as I just mentioned, we do have that capacity. We had that earlier, but we have done a lot in the last 50 days to ensure that even if we jump 5 or 6 fold, and we will take precautions that we don't go there, we are able to cope with it. So that is number one. And second is, of course, as I said, on the ground, we will need to really work with the industry. We will need to work with the central government because, there is, when you talk about the economy, the central government has a lot of role to play on this. And, I would, personally like to see the central government working more closely with the states in planning the economy strategy as well, rather than making announcements and decisions, which of course, they have the complete expertise in many of the cases. But we know that local economies function, in probably very different ways all across the India. So just like in healthcare, we saw very good cooperation during the lockdown phase. I would like to see a lot more cooperation between the center and the states, but letting the states decide and really trusting the states that if you do have the healthcare bandwidth to open up the economy and do it sector by sector, region by region, but let states now decide. You cannot have a central strategy on it.
Yes. Deepak, I'm going to come to you. What has been amazing to many people is the fact that in America, a lot of people are protesting against any lockdowns, any rules that are being applied to them, which curtail their freedom, including people like Elon Musk. To what extent is the state overreaching? To what extent is the government overreaching in some of these areas to say, do this and don't do that, we'll lock you down? Because right now, one of the fears is nobody really knows what's going to happen. When can we travel? What can we do? Now, the fact is maybe nobody can know. It's impossible to know that. But to what extent are we overreaching in these areas versus what is actually necessary to do? Just some thoughts. And then in UP and Bihar and many other states, how do you open up the economy? Monsoons are coming, agriculture is coming. How should you open up the economy? How do you utilize all the labor that has gone back there? What can you do with them to be much more productive?
Pramodji, one small suggestion I like to give it to Mr. Jasmine, because he is now the part of the Delhi government team. I was a vice chairman of Meerut Development Authority in 1987. And from years altogether, I've been hearing about NCR plan, National Capital Region plan. And after that, still this entire plan has gone for a sixer for last 30 years. Now, Delhi government, I will appeal at this time through your, even if some debate should start, that how can you decongest NCR? How can you take people out of NCR? Instead of starting the economic activities in Delhi, is basically at this time, it is high time. You see a fire inside old Delhi somewhere. Lot of factories are running inside households in Delhi. So these kind of challenges, I think I'm sure Mr. Jasmine will like to debate with his chief minister and various other people, that this is the high time that implementation of NCR counter magnet city and magnet city plans are implemented. Central government have been telling since beginning that we'll shift our offices from here. So that is the thing which has never happened in the history of India. This is a time we should debate. The second point, because NCR plans which is implemented, then majority of the economic activities will go out of the periphery of Delhi, etc., etc. Now there is no second thing. I will say that in isolation, nothing can start. If Delhi government says that I start, half of the people come from Noida or Haryana or Ghaziabad, their borders are sealed, no one will go to Delhi, and vice versa. So basically, these entire NCR region, the concept of it is a holistic approach they have to take. Something comes in Haryana government, something comes in Rajasthan government, something will come in UP government. So holistic approach has to be taken for the entire NCR, as far as the NCR region is concerned. Now, the second part you are telling is that opening up an economy in UP. Now,
I'm saying, Deepak ji, if I may, what I'm saying is broadly, where do we open up the economy? Agriculture, harvesting, all of those things. What should we do there? To me, the issues in NCR are there, but the fact is, NCR is still a small pocket. The bulk of India isn't here. How should we open this up in Gujarat, Madhya Pradesh, everywhere else?
So my answer to that, Pramod, is that if you see the people who are infected by now or in a potential infect people, if you isolate these geographical boundaries, some part of Bombay, some part of Ahmedabad, some part of NCR, rest of the India has to be left free in totality, because then the people will realize that these are the only pocket areas. If you are doing a war, look at a war kind of situation. All the sectors, if 3 sectors are important where you're fighting a war with your neighbor, 3 sectors you are pulling your forces. You are not sending all the forces and all the borders of the country. Now, basically, you have to see it from that angle. So make 90% people to live their life properly. Take them out of fear. They should live their life every day. What they have been doing since play football, play cricket, play what they are. So what they have been doing, and give them a background of the medical infrastructure. So if there is a problem, they'll go. If you have a heart attack, you will go to the hospital yourself. Doctor will take care. So basically, your job is to give them medical augmentation by testing facility and caring facility, and rest the life has to go normal. And isolate those areas which are difficult areas, make a different strategy, and leave it to a decentralized level. Even in a state like Delhi, a collector should be responsible for his, or MLA area should be responsible. Mohalla level should be responsible, not the entire Delhi. We should not speak as Delhi as a Delhi. That is the way I'm trying to suggest.
Sure. No, I understand that, but I'm asking a different question also. I'm saying, so we're going to come to the end in a couple of minutes. I want to ask, what does living with COVID look like 1 year from now? What will we do differently? How will our migrant workers behave? Will they come back? Will they trust us? Will they trust employers and governments the way they've been dealt with up till now? But what will India look like as we go forward? And what should it look like? What are the things we will do? What are the things we won't do? Just some predictions for the future, because I want to end with hope and I want to end with optimism, because there is too much fear. I totally agree with you, Deepak. We've got to eliminate that. We are frozen in time. We're almost sitting here frozen in time, and we have to get past that into activity mode. And we will have to deal with the issues as they come up. But let me go back to both of you. Jasmine, maybe I'll come to you first. What does the future look like?
Very, very difficult to predict. But one thing I certainly hope, and I sincerely hope, that the future India is one that prioritizes healthcare expenditure over everything else. this is a point that especially the Delhi government, the AAP government in Delhi has been making over the last 6 years, that healthcare and education is not just the foundation of your society, but also your economy and your future capabilities. Over the last 6 years, we've been consistently in Delhi investing 13% of our budget into health department. The average for all state governments in India is only 5%. And this is almost it's so banal now to say this. For I do not know for how many decades I've been hearing this, that we need to invest more in health. We need to invest more in health. But I think at least I hope this is the last reminder that we need as a country, be it at a state level, be it as a national level, that we need to minimum double our healthcare budgets in the coming year and systematically build our capacities. Everything else is secondary. By now, I mean, we've seen examples where over a week or 10 days, temporary hospitals have been built. And I think knowing that now there is a big reverse migration that is happening, we need these kind of facilities, which are not poor, but they're at least frugal and built quickly. But they do the job, and they should have been built in 30 days. So that is where I think a huge part of our effort needs to go in for now. As far as whether, when will the migrant workers start coming back? I think once there is some sense of equilibrium in our policy, because I mean, you can't blame them, because even right now, nobody knows what is going to happen in a couple of days from now, how much we are going to start the economy, which sectors will start really functioning, which won't. And then it is that, lack of predictability that makes workers, they don't want to pay their rents. They don't know whether their employment is secure. At least वहाँ पे भूखे तो नहीं मरेंगे. That is the point, and it is as tragic as they say that we'll at least eat, we'll be with our loved ones. So the sooner the governments work together, yes, maybe some sectors of the or industrial activity or economic activity may come to normalcy later. But at least if 70-80% of our economy starts working at a certain level, then I think that will give workers the confidence that if I go back, then I will not face the same scenario, which is I don't have a wage, I don't know how to pay my rent, and I don't have to suffer the indignity of having no food. And I think that's the answer.
But it also brings home very importantly, Jasmine, the point about workers need a safety net. We have none for them. We cannot go on. We must build that safety net along with health.
100%.
You have to have a safety net. Otherwise, you are exposing them. You're leaving them at the mercy. I saw that in skills, by the way. We ran skills businesses. Basically, they said, look, we're at the mercy of everyone once we move out of our villages. At least in the villages, we get looked after. We get some income, and that's why we go back. Deepakji, come to you for some closing thoughts on this. How should governments work together? What does the future look like? What does India look like in this world where we live with COVID? What do our consumers think? How should governments behave from your perspective? How should bureaucrats behave from your perspective? How should we change what we do?
From the bureaucrats' perspective, I'll say that the convergence of resources of various areas, the left hand doesn't know the right hand, so the left hand should join the right hand. That is the greatest change of bureaucracy, because we don't know, means we are 10 segments, verticals, which don't speak to each other. Third thing is that how with the self-reliant India, Swaraj, Gandhian model of economics going on, but I am absolutely hopeful that we have to make economically vibrant entities. The rural India has to be made economically vibrant entity. It is not like a vote bank that you would come once in 5 years to then and then goodbye. Even if political people have to be equally conscious as they go to the rural booths to collect their votes. Now this is for the time to go back to the rural India and service them, give them a remarkable service at even a booth level, what they do in politics. So I think this is the time that economics has to take over politics for some time. That's extremely important. Otherwise, I am seeing a very, very difficult scenario. If agar bhuka pet jara lamba na khich gaya na, so it will go to a civil war kind of situation. That is ultimate. But I am hopeful. I am still pray that we have a lot of religious beliefs, lot of beliefs in our river Ganga, lot of beliefs in God, that everything will be all right. We should be smiling like you. All of us should be smiling. We should be going back to a very optimistic note that everything should be all right. and especially the people of 60 years plus, the people, children, which are the great threat force, the people who are having immunity low, the people are having more medical challenges, they should have more caution. Rest the life has to be free to be attended by the medical support system. And in the meantime, whatever best is possible, I'll tell to Jasmine with a small example that you can increase number of budget by 5 times, but if it is not spent with transparency on the ground, we have got lapses of budget. We get 100 crores, 80 crores lapses, 20 crores lapses. So basically, what you do, we have a tendency of centralized procurement. We have to do everything, want to do everything at the national level or state level. Why don't you trust your people on the ground? You have to really, the political system has to decentralize everything. You have to take a mask, you have to take a rapid test. ICMR has to get it from China. Why can't every collector get it from anywhere in the world?
Yeah.
If you give him a fund.
Let me end with that. You have been wonderful to have this dialogue. I think it is a very confusing state of affairs. We can't come out with any conclusions. It's a very difficult part. Clearly, optimism, hope, prayer, whatever it is, will play a big role because we have to eliminate the fear with which we work. Decentralization comes through a theme. I actually think in the Delhi government, I must say, I've seen a lot of that happening with the health clinics that they build, the Mohalla clinics and the schools, etc. That has been very effective. I think we underestimate the challenges of rural India and in the populous states, what the impact of this could be. We have to be very wary of that. We have a lot of food stored, and yet getting that food to the right places seems to be continually a challenge for many, many years. But with that, I think with the spirit of cooperation and the need for cooperation, even among states, what I'm finding is different states are setting up their own borders. How can that work? Because if supply chains are in different states, you cannot all set up your own borders. For a while, Gurgaon and Haryana said, we won't let anyone in from Delhi. Goa says, we won't let any tourists in. Himachal says, we will only let residents in. Well, fair enough. Then we'll become small countries. We can't have that. And the last point I would just make for everyone's sake is, this is going to start affecting more and more people. I just hope that the panic and the fear that people are creating about somebody who's infected or not, or the healthcare people who are infected, goes away and we learn to live with it. Thank you very, very much for your time and your energy. We're out of time. Really appreciate it. And thank you, Charcha and Aparna and Sanchi, for pulling this together. Jasmine, Deepak,
thank you very much.
Thank you, Deepak.
Thank you very much. Thank you very much, Pramod and Jasmine and the team of
everyone.
Charcha. Thank you very much.
Thank
God
you,
bless
sir.
you, everyone. Thank you.
Thank you.